which we are supposed to discuss are the major salivary glands. Okay, these major salivary glands are meant to produce moisture, saliva in your oral cavity. Okay, in fasting, as we experience that we feel dehydrated, so there is less amount of saliva in our oral cavity. So we should know that saliva consists of the content. Can you help me to label? What are the contents of saliva? Yeah. Okay. Yeah. Very good. So you know the basics of the saliva, that it is made up of predominantly water and enzymes which you enumerate as amylase. Lysozymes are a part of it. Then protein-rich proline, lactoferrin, even IgA antibodies are a part of it. Then you mentioned thiocyanine ion, yeah, and definitely, of course, various enzymes. So it means that the saliva that is being produced by the major salivary glands supposed to lubricate and give moisture to your oral cavity. So make bolus easy, and even rather to communicate, it's easy, right? And what else it has to do? It starts the digestion of the carbs, right? And another important thing that it has to do, that it has to fight against the microorganism in the oral cavity, right? Okay. Now we will see that which factory is gonna produce them. We have got major salivary glands, the parotid, the submandibular, and the sublingual. We can observe them that they are present anterior or inferior to both ears, largest of all, and almost produces 30% of the saliva. So where comes the other ratio? Your submandibular, that is present along the angle of the mandible, again bilaterally, is supposed to produce 60% of the saliva, right? That makes 90. Now if we concentrate that there is another gland, sublingual, below your tongue, again bilateral, is supposed to produce 5 to 7%. So from where rest of few percent comes from? They are from the minor salivary gland, which you have learned in the topic of tongue. If you can recall the glands of bones, the biggest gland of fruit, right? If you can recall all that glands, and along the cheek, right? Along that mucosal area. So in the slide of lip, you also observed that there were few collection of glands. So it means that the food we are supposed to take through your oral cavity, and that should be digested with the help of various largest organs we discussed, like liver and pancreas, gallbladder also act as a storehouse of that bile, we know. And now comes the major salivary glands. Okay, let me explain the features with the help of another diagram. Okay, you are looking into a bunch of grapes. That is not to make water in your mouth just. It is to make you clear that your glands, these major salivary glands, are just similar to that bunch of grapes because their variety is compound tubuloacinar or tubuloalveolar. So can you see that your mouth is filled with water or saliva even through the smell, even through seeing that food, and even the thought of it and the taste. You see? So there is a neural mechanism that exists, that all these receptions are taken in, and your autonomic nervous system that is activated, and as a result you get all the juicy or water content in your oral cavity, right? So we can easily understand that something is coming from the exterior through all these glands into the interior. So this is very strange that our sensory reception makes these things simpler. Okay, so let's see some other diagrams in a bunch of it. Okay, so for them, you can observe another picture to concentrate that they are in the form of the alveoli, a larger elongated cut section. So let's have a sectional view of it. As we have already seen the serous and mucus secreting acini. So again, as it is a compound tubuloacinal, so we have to. So there is an acini just like a grape, right? So what it carries, again having the pyramidal shaped cells, right? So this is serous acini. So it has got basally located round prominent nuclei. Definitely all the organelles should be concentrated over here. And what else we observe? That the apical region, again like that of pancreatic acini, have got zymogen granules, you would say, filled or laden with all these contents which you just enumerated. Clear? Now what other features we expect? That we know that if we draw a cell, it has got an apical domain, the lateral domain and the basal domain. Right? That's very important to learn for your whole of life, that how the cell is presented depending upon its polarity, because it has to present different features along the different surfaces, especially in epithelial tissue or cells. Okay, so we observe here that there will be the intercellular canaliculi just to increase the surface area, right? And this communicates with the lumen, right? This is one of the features. And definitely we have got on lateral aspect the junctional complexes. Very good, right? What else we observe? If we see the basolateral surface, we see interdigitations. What are they? These are just like that if you get one cell and its plasma lemma is folded at its basolateral side, the other cell is also giving and they are interdigitating. Right? Okay. So these few things are very important regarding to this. So this is the serous acini. So the glands here we discussed, the parotid, which is anterior inferior to your ears, are the purely serous acini containing, right? Serous secretion. Then you get the other two variety, they are mixed type. The submandibular has got the serous and the mucus, but 90% of them has got serous, 10% is mucus. And what happens with the sublingual, that is below the tongue? That has got again mixed variety, but major component, 90% is through mucus. And rest of 10% is through serous. So vice versa, easy to remember, right? Okay, now let's see how the mucus acini is supposed to be appearing. We already have learned about it. So again, the pyramidal shaped cells. So what these pyramidal shaped cells are doing, they are almost occluding the lumen. We know the mucus content is filled in whole of the cell and the nucleus is being pushed towards the periphery. So we get the image like this. Either we see under the slide or we have to draw. So seems they are similar, but you can observe differences among the two. And this mucus acini don't show the intercellular canaliculi. So few differences you can make in relation to the shape of the cell, in relation to the location of the nuclei, the content inside, and few histological features like intercellular canaliculi. Right? Is it clear? Okay. Again, which we discussed in the pancreatic acini as well, that there is a very vast, well-developed ductal system. Again, the first duct that is coming out is the intercalated duct. Again, concept you know that intercalare is if you have got an orange or a balloon and you have got a duct inside, right? That very portion is called as intercalated duct. Intercalare within the cavity. The word is self-explanatory. So this is, can you now understand? Right? Okay, this intercalated and this portion of intercalated, they are joining. This is the intercalated and this is again intercalated, lined with the simple cuboidal or locolumnar epithelium. Now they are joining to form here striated duct. Right? Again, epithelial cell is same, simple cuboidal to locolumnar, right? But we call it as striated duct. So let's have a view if we have to draw a striated duct cut section. You see, For that, always try to make a clear lumen first, right? Different from that of the SNI which seems to be occluded, isn't it? Okay, and concentrate on the epithelium. These are the cells showing simple cuboidal epithelium. What striated means? That the basal plasma lemma is showing pleats-like folding, right? The basal portion, if the last row is unable to see, this is the cell of the striated duct. You can see that the basal plasma lemma is showing the folding or pleats appearing as striations, right? Is it clear? Okay. What happens along with this striations? That the mitochondria is placed or aligned itself along these pleats-like striations, right? So usually these get up or this appearance is related to those cells which have to meant for ion transport. Because we know that here, not only the SNI, right? Not only these contributing to the secretion, but this secretory, these are now called as secretory duct. Usually we call the ductal system just as a conduit. ये सिर्फ passageway है, लेकिन यहाँ आपकी intercalated duct और even striated duct, ये दोनों भी secretion absorption का काम कर रही है to deal with the resorption of sodium, you would say, and is adding the bicarbs, the potassium, and of course dealing with the chloride ions. Is it clear? So it means कि ये दो duct ना सिर्फ passageway फराहम कर रही हैं, the content located here ये भी अपना content डाल रहे हैं, ये भी take part कर रहे हैं. So the question MCQ can be asked that name the ducts that are taking part in this activity. So you have to mention that intercalated and striated duct are part of it. Okay, we know that on every these glands have a covering called as capsule, right? Made of again dense irregular connective tissue. And what this capsule has to do? It sends trabeculae inside. What trabeculae is? Septa, to separate the major lobes and then into the lobules. And that septa definitely allow the passage of blood vessels and all the neurovascular bundle, in short, you can say. And of course, you can observe the ducts. So, if you imagine that this is a lobule, right? The major one could be the lobe. So, if this is a lobule, so these two, this articulated and this striated, they are both inside the lobule. So, we can label these both as intralobular, right? If somebody asks, which ducts are part of intralobular, you would say the intercalated and the striated. Now, what is going to happen? There are so many things from the other SNI coming, if I make more SNI, and they are joining to form much larger duct that has to pass through the connective tissue which is separating one lobule from the other. So now they are called as here interlobular. Is it clear? First it was like intravenous, intralobular. Now it has become in between one lobe and the other lobe. So interlobular. Now imagine that it has to go out and out and passing through the bigger road. The small roads from the home have started with these names. Now this intralobular has to become interlobar when it has to pass in between two lobes. पहले lobule का सफर इसने तय किया, फिर अब ये lobes में से गुजरेगी. So interlobar, and then it will be touching towards the main duct. If it is parotid, you call it as parotid duct. If it is submandibular gland, you have got submandibular duct. And if you've got sublingual glands, both sides have got sublingual ducts. Those are the major ducts. So this is how, if we compare it with a bunch of grapes and you are holding it, so that main stem is the parotid duct, submandibular, sublingual. Is it clear? और जो आपको SNI या bunch of grapes या melbury से first छोटी बारीक जो आपको stems मिलती हैं वो intercalated कहलाएंगी, right? और वो आगे मिलने के बाद striated बनी, वो सारी कहाँ lie कर रही है? In the lobules. So you label them as intralobular. When they are making another course called as interlobular, then interlobar, and finally the main. Is it easy? Okay. So epithelium definitely changes. That in up to this intralobular we observe the same Interlobar may dress similar, and when it has to reach into the interlobar, it will become the pseudo-stratified, right? And when it touches to your main, like parotid duct, it will be showing the stratified cuboidal or columnar. And that parotid is opening into your oral cavity against the upper second molar tooth. You will learn in your head and neck. When you learn the oral cavity and the openings of it and the relations of it, will let it know that the parotid duct is going to open against upper second molar tooth. So this is how the exterior passage and production of all the saliva and the content is entering, giving moisture to your oral cavity. Right? Okay. Now that very area which is opening into the oral cavity will be showing epithelium, stratified squamous, non-keratinized. So let me make it simpler कि आपकी यहाँ दोनों जगह से simple cuboidal और simple columnar start हुई थी जो कि ऊपर इंटरलोबार में जाते जाते आपके पास बन गई सूडो, सिंपल से सूडो की तरफ आ गई फॉल स्ट्रोक, फिर ये हो गई स्ट्रेटिफाइड कोलमनर या क्यूबॉइडल, और जैसे इसने ओरल कैविटी को टच किया वहां पे आपकी क्या एपिथेलियम थी, स्ट्रेटिफाइड स्क्वेमस नॉन केराटिनाइज्ड, क्योंकि जैसा देश वैसा भेस आपकी ओरल कैविटी में जो आपको एपिथेलियम यही मिलती है. सो सडनली व्हेन इट ओपन्स एंड रीचेस टू द interior opening, it will be changing accordingly. So simpler if somebody asks you how to explain it. Okay, now we have to understand few pictures along with it. Yeah, this is a picture to make you clear that how this bunch of grapes which resemble with your slimy glands appear. So this is the serous acini, if you can see, and this is the serous acini with the rounded nuclei, and this is mucus acini because it is showing this peripheral located nuclei. Right? What else you observe here? That there lie, if you concentrate on this yellow color, let me again. Okay, these yellow color cells are there called as myoepithelial cells. So word myoepithelial means it has characteristics of both. Myo means muscle, so should give the feature of contractility. Epithelial because it is lying around it. So if somebody asks where it lies, it is present against the basal plasma lemma and the basal lamina of these acinar cells, right? And present here. When they contract, what they do, they will propel the secretion towards the center or lumen of the cavity, right? So sometimes you see these are against the gravity as if we are standing. The glands are on its lower portion. Still we have got saliva inside our mouth. So how this happens? Along with this secretory activity, no doubt, and with the aiding these cells present called as myoepithelial cells. If you grossly observe them, as they have got body and processes on its both sides, and how they are giving contractility, they must be having actin and myosin filament. ठीक है, जिसमें भी आपको ये फिलामेंट मिलेंगे, they are meant to give contractility. और अगर आप इसको ग्रॉस ऑब्जर्व करें तो it looks like this, कि इसके ऊपर ropes रस्सियां लपेटी गई हैं. कुछ इस तरह से myoepithelial cell like an octopus इसके ऊपर होते हैं. And if you cut, you observe the body and the processes, right? Okay. After that, another important thing that there is another structure called as serous diminules. Let me draw it. Serous diminules are what? They are just like a half moon shaped structure. Serous diminules means serous acini are appearing as half moon or cap like structure. As if we see that this mucus acini, which is looking empty in the center when we observe the slide, there is a cap on it. This one is called as serous diminules. So there are different schools of thought, but usually this is the artifactual production when we make a slide, and these acini, they swell up by giving the content to make it or to fix it, so it appears as a serous diminules. So much prominent over the capping this superior surface of this SNI, right? So if we can imagine, this is an SNI which is mucus, and we have got a cap over it, which is of serous variety. So we call it as half moon. Lunar word is through moon. So cirrus demilune means half moon shape, crescent shape. This is called as cirrus demilune. This is also present. So what we learned about the SNI, about the duct system, and if I make the myoepithelial cell here, in between the basal plasma lemma and basal lamina, with the processes, they lie here, right? And another important thing, the cirrus demilune. So these are the features. If somebody asks you about the ductal system and their cells, here you can observe that these are the serous demiliones and these are the myoepithelial cells, and whole the ductal system works. So let's see some slides. Okay, this is just to tell you that if we rapidly freeze a slide, there could be overlapping of alternative cells if there is such fixation, but in usually conventional fixation, that happens that due to artifactual look, this serous demiliones appear as a cap around the main SNI, right? Okay, that is just to add your knowledge. Okay, now we are looking into a histological section. That seems quite different from the thing we have learned. But this is in actual that we have got elongated sections which are showing empty lumen. What are they? They could be the mucus SNI, right? So among the three major salivary glands, the maximum number of mucus SNI are in the sublingual. And what's special about sublingual, that the connective tissue capsule or septa are not very much conspicuous here, or they are poorly developed. So you see them as a one piece. So there are so many mucus SNI filled all around with the serous SNI which are less in number, but special thing that every mucus SNI is covered with a cap-like structure, the serous demiliones. We just learned, right? So this is the look of this sublingual gland. Okay, you can observe various intercalated duct sometimes and other ducts striated, but they are not very much prominent in sublingual. But in parotid and the submandibular, the intercalated duct and the striated duct, they are much prominent, right? Okay, so this is the sublingual gland. Let's see some other histological pictures. Okay, these darker stained are the serous SNI, beautifully shown with their basally located nuclei, and the apical region is showing the granular appearance. So apical zymogen granules are seen in these SNI, the pyramidal shaped cells, right? So you can see these serous SNI, and in between this all game, you can see the intercalated duct. Can you see? This is the intercalated duct, and now a beautiful striated duct. What happens in striated duct? That due to the presence of basal striations, which we discussed, the nuclei of all these cells are pushed towards the apical region or towards the center. Usually, the nucleus is located basally. Can you see? In other cut section of the SNI, sort of, or other ducts, if you can see that intercalated as well, but in striated duct, you observe them towards the center or apical region because they are striations. So there is a very clear-cut lumen in the ducts, either here or either here, but the SNI are showing almost occluded lumen. This is the major difference, that how you differentiate among the SNI and the ducts, right? So there could be a slide of parotid gland. So let's see some other things. Okay, again tissue that is showing either upper portion or lower. The darker stain are all serous SNI. But here you observe a chunk of, a collection of mucus SNI. That portion is enlarged, and you can see this mucus SNI with the cap, serous demiliones, right? So that gland which shows 90% of the serous SNI and 10% of the mucus SNI is the submandibular gland, right? Here we observe very clear the striated duct if they are there, and the intercalated duct along with the other duct system. So So let's see some other diagrams if they are helping you. Yeah, this is an electron microscope structure to show you the various cells structure. If you can see, this is the lumen and this is the apical region, this is the basal region, and that was just to add in your knowledge that how the electron microscope structure looks. Again, the striated duct. Now you can see the nuclei are pushed towards the apical region or central, and striations are very clear. So it means even on light microscopy, if you concentrate or take it to the higher power, you can observe the striated duct, and the darker stain nearby all the cut sections are the serous acini. Okay. Yeah, what it could be? This empty look. Yeah, this is sublingual, very good, because they are addressing the empty or mucous acini all around. And duct could be there, right? And a few serous acini are apart. There is another special tissue you are looking into. What it could be? Through your previous knowledge, first year. This is the cut section of something, the muscular tissue. Right? So how it appears as a muscular tissue, you can imagine that if it is nearby your muscles of facial expressions. So they are skeletal variety. So if you concentrate, if it is a transverse section showing the skeletal muscles, right? That may come in the tissue when you are examining. This is important to emphasize on every tissue. Always scan, try to scan from one corner and reach or explain everything towards the end, because this is how you will come across that this is not an abnormality. That is an additional tissue that can come in your way while making a slide. Okay. So can you examine your parotid duct? Can you feel it? Is there any procedure you can do? You will learn it in, I think, head and neck, that if your examiner asks you that how to examine the parotid duct, you just clench your teeth. What is the clenching of teeth? When you clench tightly, what happens? Your masseter muscle becomes prominent, right? And on its top, the horizontal course is through the parotid duct. So this simple maneuver will tell the examiner that you know how to palpate the parotid duct, right? Okay. That was again a picture showing the what it could be all around the serous acini. Purely serous is parotid gland, right? So let me make you recall the parotid is purely serous. Submandibular and sublingual are mixed. Sublingual में आपको mucous acini predominantly मिल रहे हैं, और आपको submandibular में you get maximum variety of serous, but few of them are the mucous as well. This is again a schematic good diagram, I think taken from Ross or Lycosan. So you can observe the mucous portion and the serous. You can observe various myoepithelial cells. You can see the striated ducts. And here intercellular secretory canaliculi is being shown near the apex. So there are few features that help you. If you just remember one or two such diagrams, you've got grip on the subject that how to explain the ductal system. That can be asked. Okay, there is another schematic, we would say, picture of the gross. How the parotid salivary gland is present. The clenching make the masseter muscles prominent, and you can trace the parotid duct opening against the upper second molar tooth. Now you can observe the mucosa inside that the cut section, and you observe the submandibular duct here, this duct coming from the submandibular gland, this major duct, and you can observe the sublingual gland along with the small ducts which are joining to the sublingual ducts, right, towards the portion of your oral mucosa, right. So this is the picture to correlate the things. Again a picture, the upper picture is showing you the serous salivary gland, which is parotid, right, and the lower picture is showing you the sublingual mix. So this is how when you see repeatedly different sections, you are able to pick. So now let me discuss the slides because they are important now. Okay, one of the slide in front of you is another important thing. Let me explain that whenever the age increases or reaches up to 40 or more, your the salivary glands, this parotid is well laden with the adipose tissue. Now you can see this whitish area showing the adipose tissue intervening, and rest of all these tissue are the serous acini, right? And these lumen structure are the glandular portions. So now change it towards the 10x to make the image more clear. Now this is the larger duct intervening, and you observe that it's being lined with the simple cuboidal low columnar epithelium, this portion, and these are the serous acini, very closer, just like a bunch of grapes. This is just as if you are holding a bunch of grapes and you have placed a cut section. Now you're observing like this, and these are small lumen. So these are whole serous acini, and intervening this hole is adipose tissue, if you can recall the signet ring appearance. And rest of it, this is the parotid gland with the serous acini and the ducts, which are very clearly seen. Whenever you get any lumen structure, you will label them as ducts, or if you observe the simple squamous epithelium, we call it as that it should be some blood vessels. There is another duct, right? So epithelial tissue helps you to recall that either it is a duct or it is a blood vessel. So this is the parotid duct. So let's see some other slide of other glands. Okay, so we should start from one end. So this is the submandibular gland, and we have got on its outer side the connective tissue capsule that is sending septa to divide it into major lobes and smaller lobules, right? And if we concentrate any one lobe, so these maximum are serous acini, but somewhere we find the collection of the mucus bunches as well, and various ducts. This is a view at the 4x. Let me make it on 10x to make it more clear. Okay. Now 10x, you can observe these all serous acini because they are taking very good stain. And if there is a clear duct, that is the intercalated duct, first duct. And intervening adipose tissue is definitely you are observing, and the connective tissue, right? Let me search for, these are all serous acini. Is it clear? And these are the ducts which show the clear lumen. These are all serous. So as we have quoted that there should be a bunch of mucus acini. So let's find a place where we get the mucus collection. Yeah, this portion has come. Can you see this is the bunch of mucus acini with the periphery nuclei, right? So this bunch is intervening in between all these serous acini 90% and this one bunch, and there is another bunch. These are showing the mucus acini. So this is how you locate that this is the submandibular gland. In exam, we can focus the view in which maximally you are looking into the serous acini with various ducts, and there could be a collection of mucus, and in OSPE you have to write that this is the submandibular gland and give 2 points of identification of each. You can rotate it, you can see it throughout that how serous acini appear, how ducts are clearly seen with their lumen, and how intervening adipose tissue can be a part, but if you concentrate at some bunches, we can observe the mucus acini. Let me find some other bunch to make you more clear. This is adipose tissue also. So it means it needs a little bit search to find out. The adipose Yeah, this is the bunch. This is the bunch of mucus acini, right? So this is how you will observe that this is the submandibular gland. So okay, the last slide, which is the sublingual. Okay, about sublingual, we have learned that the capsule and the connective tissue septa is not that much well developed. So you can see that there is a thinner capsule and hardly you are observing them as a separate lobe. Rather, it is appearing as one piece, but as we know that there is a septa. And what special thing is that every center of the SNI is looking empty. So it means the maximum presence of mucus acini, and why they are darker at the periphery, they are wearing a cap of serous devolutes. So let me take it to the 10x. So this is how you can see a collection of, these are the mucus acini. So concentrate that the center is empty, but the periphery is all darker, being shown that every mucus seems to be wearing a cap. So all this is mucus acini with the serous capping. This could be a duct with a clear lumen. Another duct you can see. Ducts are there because there are interlobar main sublingual ducts would be a part of it. And intervening that could be a blood vessel if simple squamous epithelium is there. So these thin streaks are the connective tissue septa, which is not well marked. So this is a slide of sublingual gland. So let me show you another slide. Sometimes we have to run the OSPI in two batches. So we have got another parotid gland that mimics with the submandibular because they rarely contain the mucus acini, but it is showing the section. So this is the parotid gland, right? Again, very clear lobes and lobules. The duct system is there. But as you can see that few mucus acini are a part of it. Because this slide has come from some place and being labeled as a parotid gland. So in exam, what we do, we will select a part that will be showing purely serous acini. Right? And I usually say, or another examiner, that please don't change the field. The purpose is that if you have learned and that they are all serous acini, you label it as that it is a parotid gland. But if some of your colleague rotate its view and bring this into the section, what happens? That you write it as a submandibular, then it would be wrong. We preferably use the single slide that is well laden with the adipose tissue. But usually due to limitations कहते हैं जी डबल स्लाइड आपको चलानी है और दो बैचेस बना देते हैं, तो हमारे पास दूसरी जो पेरोटिड ग्लैंड की स्लाइड है वो कुछ ऐसी है जिसमें कहीं कहीं आपको ये म्यूकस का चंक भी दिखाई देता है. तो हम कोशिश करते हैं कि आपको वो वाला एरिया दिखाएं जिसमें प्योरली सीरस हिस्सा दिखे और आपकी स्लाइड गलत ना हो. So your kind cooperation is required कि आपने फिर चीजें हिलानी नहीं होती in a sense, just to make it clear for your colleagues. So thank you very much for today. आपको स्लाइड लगा देते हैं.